Today we will try to understand depression from within and how it affects your life. Most importantly, I will explain this with the help of real-life examples, showing how I treated patients with depression so you can understand even better. Therefore, make sure to watch the entire video. Depression is basically a feeling that manifests as sadness, low mood, and lack of interest. It can affect people of any age group, be it children, adults, or the elderly. In children, it often appears as irritability and anger. However, most of the patients I see are very sad and depressed. I noticed that in many patients, there is a common presence of low energy, lack of motivation, and loss of interest in things they once enjoyed. For example, someone who used to enjoy listening to music no longer finds pleasure in it. Someone who used to enjoy doing household chores now feels disinterested. There are countless examples like this. Basically, the interest fades away and everything feels like a task. Additionally, patients find it hard to get out of bed in the morning. They constantly feel frustrated or irritable, either angry with themselves or with others. Negative thoughts keep flooding their minds, making it impossible to think about anything positive, and life starts to feel meaningless, utterly hopeless. They don't feel good about themselves and experience a sense of worthlessness. There are many such symptoms, and if I begin explaining each one, it would take me 5 minutes just to cover the common symptoms. That's why we've already created a list of 60 symptoms of depression. Make sure to check it out after this video. You'll find the link in the description. Let's get back to the main topic. Another significant reason for depression is that people keep dwelling on the past, feeling like they've made so many mistakes that have made their life miserable. When these symptoms become severe, suicidal thoughts can arise, meaning people start to feel like they're losing at life. By now, you must be getting an idea of how devastating depression can be in anyone's life. Though this is a sign of severe depression, it often starts with higher functioning depression, meaning you continue to perform your daily tasks, but life feels like a burden. This gradually transforms into severe depression, sometimes within weeks or even days. Now, let me share some real examples to make this even clearer. Pay attention, as I'll later explain how I treated it. A teenager's parents came to my clinic and shared that their child had been feeling irritable and frustrated. He spends most of his time in his room and doesn't talk to anyone. He used to go out with friends, but not anymore. If anyone tries to talk to him, he gets angry. The parents felt like living with their child was becoming like walking on eggshells. Another example is an adult patient. His wife shared that her husband used to be fine, but now he seems more troubled and depressed. He finds it hard to leave the room and just wants to be alone. He struggles to get up in the morning and go to work. When he returns home, all he wants to do is sleep or be alone. His wife came to me for help when she felt things were getting out of hand. One last example. A woman who used to be very social, enjoyed cooking and gardening, now feels like everything is a burden. She avoids phone calls and social gatherings. Her husband complained that the house, which used to be very clean, has become messy, and he now has to manage everything. You can see how depression affects anyone. We took different examples to show that depression can happen to anyone, and the symptoms can vary from person to person. Now, I will give you an overview of how I handle cases when a patient comes to me. Although there are many ways to handle depression, I will give you an overview. When a patient comes to me, the first thing I do is evaluate whether there is any medical cause behind their depression. We conduct lab tests to check for conditions like anemia, lack of blood, because low energy can also be caused by anemia. Another common thing seen in depression is low thyroid hormone, hypothyroidism. If thyroid hormone levels are low, symptoms may resemble those of depression, such as lack of energy, loss of interest, weight gain, or weight loss. Next, if lab tests and physical exams are normal, I recommend therapy to my patients. In depression, our way of thinking becomes rigid and negative, so they need to work on their thoughts and thinking patterns. Talking to an objective person during therapy can provide clarity and support, which is crucial during depression. The patient example I gave had severe depression, so I started them on medications. Medications give them the energy and motivation to work on their thoughts alongside therapy. I also recommended to the patient's husband that he should attend support therapy so he could understand what depression is and how to support his loved one. When his wife started feeling better, I suggested marital counseling because depression had caused some issues in their relationship. Depression is a multifactorial disorder, meaning it can have many causes, from chemical imbalances to environmental issues. Therefore, treatment also consists of multiple components like therapy, a support system, and medication. When people are going through depression, they need support. They need to feel that they are not alone. I educated the husband on how to make his wife feel that she is important in his life and that she is not alone. I call my patients for follow-up appointments every week so that their support and treatment can continue. This results in improvement in their condition, and after some time, they recover fully. I hope you learned a lot from this video. If you want more videos like this, where I explain things in detail, please like and comment on the video to let me know how you found it. And don't forget to subscribe to the channel. Thank you so much for watching the video.